We are emerging out of a really generational defining event in COVID.
1.8 million Pennsylvanians have some degree of mental illness. On top of that, 600,000 people within Pennsylvania have mental health services that they should be getting or desire that they have not been able to access.
One of the biggest effects that we're seeing is across the age span is increases in mental health issues, from our littlest learners to seniors to everyone in between.
The American Academy of Children and Adolescent Psychiatry, as well as the Children's Hospital Association, have declared a national emergency for child behavioral and mental health.
The U.S. Surgeon General has said that social isolation and loneliness is a public health crisis in our community. So it's important that we address that and the mental and physical impact that that can have, not only on older adults, but on our community in general.
Everyone is impacted when mental health becomes a concern.
It takes a village to take care of the community. So really being united with community-based organizations, with government agencies, the school district, to serve our community is key.
And that's why we're launching a new initiative called United for Mental Health. And it's a way for everyone to get involved and be part of the solution.
The United Way partnership with the Bethlehem School District is crucial.
There is a relationship between students' mental health and their ability to learn. United Way is a supporter of the community school movement to help support Bethlehem schools to be community schools.
They assist us not only in helping us understand the science of trauma and what that training process looks like, but also developing an ability to connect with community partners. Everything from food insecurity needs to housing insecurity needs. We have a strong training process for trauma-informed practices.
We work with nurse-family partnerships, child care centers to make sure that young children and their parents have access to what they need. One of the things that we really focus on is behavioral health access, to be able to ensure that all students have access to behavioral health services in a place that they trust.
We've expanded our inpatient services, our partial hospitalization services, to allow people to have more access to therapy, psychiatry visits, to have embedded therapists in our school systems, to provide walk-in center where people off the streets can come in and get immediate care and connection to resources.
Valley Health Partners, the community health center, we're a part of a national movement designed to bring primary care and preventative health care services to a community's most vulnerable population. It's essential to partner with schools to provide healthcare services. Children, this is where they're learning, where they play, and if we can bring healthcare to them here directly, then you really get that one-stop shop.
What United Way is doing to address mental health concerns in our community starts at the earliest ages and goes all the way up to our seniors and our older adults.
25% of our senior population is impacted by social isolation. So it's really important that we connect them to the resources that they need. One of the ways that we're trying to do that is through our Community Hubs initiative. There are 5 of them. They're easy to access by transportation. We notice that lack of access to food, to social interaction, to resources was impacting our older adults. So we established our community hubs so that we can have all those resources in one place.
Mental illness is not a personal failing. It is not something that is chosen. People do not choose to suffer.
Mental health is the cornerstone of a society. When we invest in mental health, the entire community benefits.
For many years, there's been a stigma around behavioral and mental health, and we need to get beyond that and talk about it as a community.
What I would like to see as a vision of the future for mental health is not focusing on reactivity to mental illness, but rather prevention and promotion of mental wellness.
United Way has had a strong commitment to mental health, to partnering with the schools, to bring in resources, and to hear from the voice of our community. And that's really how we'll start to make a difference.
You can be a part of the solution by donating to this fund.